Welcome to the OU Psychiatry Residency informational video. Please keep in mind, as we have learned in the COVID-19 pandemic, all information is subject to change. Dr. Zappola is our program director. Julie Frost is our program coordinator. We have a rich department full of faculty always available for support. The rotation schedule is as follows. In the PGY 1 year, 6 months of off-service rotations are completed, including 2 months of neurology at the VA, 2 months of inpatient family medicine at OU, 1 month of outpatient family medicine at OU, and 1 month of inpatient pediatrics at the Children's Hospital. The 6 months of on-service psychiatry rotations include 3 months of VA inpatient psychiatry, 1 month of VA consults, and 2 months of VA night float. In the PGY 2 year, 3 months are completed in OU Edmond at the Autumn Life Geropsychiatric Unit. 2 months are at OU consults, 1 month of VA consults, 1 month of VA inpatient psychiatry, 1 month of inpatient psychiatry at the Griffin Memorial Hospital, 1 month of elective time, and 2 months of OU child and adolescent consults. If you're interested in a child and adolescent fellowship, 1 day a week on this service can be spent on an inpatient child unit. In the PGY 3 year, outpatient clinic is completed at the VA and at OU. If you're interested in child and adolescent, you have the option to have a few days of child clinic per week. In the PGY 4 year, you have half a day of continuity clinic per week, and the rest of the months are divided between sub-attending months and elective months. The call schedule is as follows. In the PGY 1 year, the VA inpatient team, the VA consult team, and the OU consult team are covered. Monday through Thursday, interns complete a short call from 4 p.m. to 8 p.m. in-house. And on Saturday and Sunday, a long call is completed from 8 a.m. to 8 p.m. in-house. In the PGY 2 year, the OU Autumn Life service is added on to the call services. Most of the call services in the PGY 2 years are completed remotely. From Monday through Thursday, from 4 p.m. to 8 p.m., the OU Autumn Life service is covered, and from 8 p.m. to 8 a.m., the OU consult team is added. On Fridays, from 4 p.m. to 8 p.m., the OU Autumn Life service is completed remotely, and the VA inpatient and VA and OU consult teams are covered in-house. From 8 p.m. to 8 a.m., all services are covered remotely. On Saturday, from 8 a.m. to 8 p.m., the OU Autumn Life service is covered remotely, and from 8 p.m. to 8 a.m., all services are covered remotely. On Sunday, 8 a.m. to 8 p.m., the OU Autumn Life service is covered remotely, and from 8 p.m. to 8 a.m., the OU consult team is added to that and also covered remotely. The VA services are covered by the night float intern on Sunday through Thursday nights. During the PGY 3 and 4 year, there is no call.
I feel well trained. Every once in a while I still have questions, but for the most part I pretty much feel like for sure I'm safe, and for the most part I know where I'm going with treatment and with patients. Sometimes I find myself forgetting that I'm a resident and I kind of almost forget to check out. I'm getting to that point, but overall I'm feeling pretty comfortable.
So I think the feedback system here is really great. I feel like I've gotten feedback in a timely manner to the point where I'm able to adjust before bad habits are solidified. I've gotten feedback throughout my rotations, kind of just little things here and there, and then we'll get one big giant feedback at the end of our rotation, just kind of summing up our entire experience, and I really appreciate the way that they do that.
The work-life balance has been pretty good. The program's really good at using an app on the phone to track work hours, make sure that you don't go over, and always to make sure to report if you're in danger of going over. Since then, I've never had any issues with that. The program's been pretty balanced. Our relationship with our attendings is pretty close. I feel completely comfortable to go in and talk to an attending about any issues, any concerns or questions that I have about patients and their treatment plans. The attendings have been extremely available and quick to respond with any questions.
We have good working relationships with family. We have good working relationships with neurology. We do rotations in all of these during intern year, and we become very close, not just within our own residency, but with other programs as a bigger OU family.
Thursday lunches are reserved for grand rounds, journal clubs, or M&M conferences. Residents are required to complete 2 journal clubs and 2 M&M conferences throughout their training. Friday mornings serve as protected time for didactics, which have now moved to a virtual platform.
So OU has a ton of research opportunities. Research in our residency is just published from the heart.
One of the most beautiful things about our campus is that most of our rotations are completed on one main campus. OU Medical Center is our main hospital. We also spend several months at the VA and the Children's Hospital. Our outpatient clinic is right on campus as well, and these buildings are mostly connected via a skybridge system. A few days of clinic are spent at the Stevenson Cancer Center just across the street, and our geropsych unit is at OU Edmond, just 15 miles north of the main campus.